The male reproductive system has its components, which involves the primary organs, the primary sex organs. We have the male reproductive tract, then we have the glands present there, and the external genitalia. So in this section, we'll be studying in detail about the components of the male reproductive system. We'll also be studying in detail about the scrotum, what is this organ, how it is formed of, the anatomy of the scrotum basically discussed here, the blood supply and the nerve supply will also be discussed in this section. Now, the components of the male reproductive system involves the primary sex organs. The organs involved in this step, which is the testes. Now, the reproductive tract involves the epididymis, the vas deferens, and the spermatic cords. Accessory glands involve the seminal vesicles, the prostate gland, and the bulbourethral glands. And lastly, the external genitalia, which involves the penis. So these are the four major categories of the male reproductive system, which further involves the four things in which the organs are subdivided here. So the first thing we have is the organs, which is the primary sex organ, which is the testes present inside the males. The tract involves the epididymis, the vas deferens, and the spermatic cords. The detail of these structures will also be discussed in the later on sections. The glands present here are the seminal vesicles, which are releasing the semen fluid, the prostate glands releasing the hormones, and the bulbourethral gland, and the penis, which is included in the external genitalia. So here you can see the structures present in the components of the male reproductive system. You can see the glands present here. This is the seminal vesicles, the prostate glands located here. This is the bulbourethral gland present below the prostate gland. Then here are the testes, which is a primary sex organ. Then comes the penis, which is the external genitalia. Then other structures are the scrotum, the epididymis, and this is the vas deferens. All of these are the components of the male reproductive system. So talking about the scrotum basically, I've told you it is included in the category of the reproductive tract. So the scrotum basically has three major paired, or you can say the structures, which involves the testes, which is the primary sex organ. So it is a site of sperm production. This organ basically is involved in the production of the sperms. Then comes the epididymis. It is situated at the head of each testicle. So on the superficial surface, you can see the epididymis is located on the head of the testes, and the functions, the purpose of this organ is it functions as storage reservoir for the sperm. So basically the sperms which are being produced by the testes are stored here in the epididymis. And then comes the spermatic cord. So the name indicates it's a cord. It is a collection of muscle fibers, vessels, nerves, and ducts that run to and from the testes. So these are the cords running towards and away from the testes. The scrotum overall is divided into three structures, which is the testes, epididymis, and the spermatic cord. So testes are the site of the sperm production. Epididymis are the storage site for the release for the reservoir for these sperms, and the spermatic cord are basically the collection of the muscle fibers, the nerves, the vessels, and ducts that are running away and towards the testes. So you can see here the scrotum area, which is including this testes, and on the superficial surface we have the epididymis that is located, and it is a storage site for the storage of the sperms, and these are the seminal vesicles which is running to and towards and away from the testes. The arterial supply to this region involves the arteries that are supplying this region. I've told you that the arterial supply to the major to this male pelvis region is majorly originating from the common iliac arteries, which are further subdivided into two main branches, which is the external iliac artery, and then comes the internal iliac artery. It gives off its further branches named as the internal pudendal artery and the external pudendal artery. So here we have is the posterior scrotal artery supplying the region of the scrotum and the anterior scrotal artery. So these are the two major arteries which are supplying the region of the scrotum. Here we have the testes and epididymis and the seminal vesicles are located here in this region. So major arterial supply to this region is the posterior scrotal artery and the anterior scrotal artery, which are majorly originating from the external internal iliac arteries, the branch of common iliac artery. Then comes the venous drainage. So the veins are, likewise we have the scrotal arteries, the superficial and the deep ones. So here we have is the scrotal veins. Again, we have the superficial dorsal vein of the penis, and we have the deep vein of the penis. So following the major arteries that are supplying this region, the veins, most of the times the veins are accompanying the arteries which are supplying to that specific region, and they are draining into the external pudendal veins. So now that the backflow of this blood occurs, there is a sequence of the blood that is coming down in the arterial supply, and in the venous drainage the same sequence goes back. So here we have this is the region of the scrotum. The veins we have is the superficial dorsal vein of the penis that is going to be entering into the external pudendal vein. This is the external pudendal vein. On the either sides, we have this external pudendal vein that is carrying the blood from this region, and then we have this superficial external pudendal artery. This is superficial dorsal artery of the artery. These are the arterial supplies, and on very adjacent to it we have superficial external pudendal veins and superficial dorsal vein of the penis. So these are the venous drainage of this region. Then comes the nerve supply. So nerve supply involves the genital branch of the genitofemoral nerve. You can see in this picture as well, this first vein is the genital branch of the genitofemoral nerve supplying the region of the scrotum. Then we have anterior and posterior scrotal nerves. So here you can see only the posterior scrotal branch of the perineal nerve. So the posterior, both we have the anterior and the posterior scrotal nerves are supplying this region, and also we have the perineal branches of the posterior femoral cutaneous nerve of the thigh. So we have this is the perineal branch of the posterior cutaneous nerve of the thigh on either sides. So other nerve we have is the ilioinguinal nerve, L1. Then the genital branch of this genitofemoral nerve is the nerve supply. Then we have the anterior and posterior scrotal nerve supplying the region of the scrotum. And then we have is the perineal branches of the posterior cutaneous nerve of the thigh. So this was it from the section 1. Here we've studied in detail about the 4 components of the male reproductive system in detail, and the organs which are subdivided into those 4 branches. And then we also studied about the scrotum, the anatomy, the parts of the scrotum in detail, how it is divided, how that specific region is further divided. We studied about the blood supply, the nerve supply to this region, the venous drainage of that region in detail. I hope it is really clear to you now. Thank you for watching sqadia.com.